Welcome to this deep dive. Today, we have a truly fascinating mission lined up for you.
We really do.
We are exploring the absolute cutting edge of neuromodulation and alternative therapies. We're going to look at exactly how light, sound, electricity, and guided focus are being used right now to essentially hack the human nervous system.
And it is a massive stack of sources we are pulling from today to get you fully up to speed on all of this.
Yeah, exactly. We're looking at medical fact sheets on hypnosis from the Better Health channel, the biography of a pioneering music and health researcher named Lee Bartell, and a detailed brochure for a highly specialized $23,000 stroboscopic light device called the Lucia N Degrees 03.
Which is quite the device.
Oh, it's wild.
Yeah.
We also have a dense scientific paper from the MDPI journal on vagus nerve stimulation, clinical guidelines from a hypnotherapy clinic called Nord, and finally, the safety protocols straight from the manuals of Therabody.
It is a vast amount of material. I mean, it really is. But there is a brilliant overarching theme tying all these disparate sources together.
Right.
What we are seeing is a profound convergence. We are taking ancient fundamental healing concepts, things like entering a trance state or utilizing therapeutic sound and light, and we are combining them with highly precise modern medical technology.
And people are using this for everything now.
Exactly. This synthesis is currently being used to treat an incredibly wide array of conditions, from chronic physical pain to severe treatment-resistant depression. We are actively mapping and learning to manipulate the body's hidden control panels.
Okay, let's unpack this. Starting with a modality that historically has a bit of a PR problem.
Hypnosis.
Yes, hypnosis. When you hear the word, the immediate cultural association is often the guy with a swinging pocket watch turning people into clucking chickens on a stage.
Right, the whole carnival sideshow routine.
Exactly. But looking at the Better Health Channel medical fact sheet, the clinical reality is entirely different. Hypnosis is not mind control. It is actually a completely natural, spontaneous state.
And we all experience it.
Every single day. The fact sheet points out that it's like daydreaming or getting so absorbed in a book you lose track of time, or even, doing the dishes on autopilot where you finish the task but have no active memory of doing it. It's a natural state of focused consciousness.
And that distinction is crucial for understanding its clinical application. The source material emphasizes that you are always in control. You cannot be hypnotized against your will.
You can't be forced to rob a bank or anything?
No, nor can you be forced to execute a suggestion that violates your core values. Clinical hypnotherapy is the voluntary altering of your own consciousness. By intentionally entering this deeply relaxed, internally focused state, the conscious, critical, analytical part of your brain quiets down.
It just takes a backseat.
Right. This allows your unconscious mind to become highly receptive to new therapeutic suggestions. Clinically, this altered state is leveraged to treat conditions like anxiety, insomnia, and chronic pain that just hasn't responded to traditional pharmacological interventions.
And this brings us to a really fascinating evolution of this practice. One of our sources outlines a clinical guidelines from NordVaka Hypnosis, founded by Greg Newton.
His background is fascinating.
It is. Greg's background is actually what makes this so interesting. He is a former cybersecurity executive.
Wow.
Yeah, he literally spent his career identifying vulnerabilities and securing complex computer networks, and now he's applying that exact systems-level thinking to the human mind with something they call the Nordlys system. He treats the subconscious almost like an operating system that needs a security patch.
The translation of cybersecurity architecture to human psychology is a really compelling framework. I mean, standard talk therapy, such as cognitive behavioral therapy, is undeniably valuable.
Yes, sir.
But it operates primarily on the conscious mind. Because of that limitation, it can take months or even years to see a profound shift. Our conscious analytical mind has evolved to act as a firewall.
Right, to keep things out.
Yes, it naturally resists sudden change to protect our established worldview. The Nordlys system attempts to systematically bypass that firewall. It uses a specific clinical hypnotherapy protocol called 5-Path, which is a structured, phase-based approach designed to identify the root cause of an issue rather than just masking symptoms.
But it's not just sitting and talking.
No. What makes Nordlys unique is that it supercharges this protocol by engaging multiple physiological senses simultaneously to force the firewall down.
Right, you aren't just sitting on a leather couch talking about your week. The guidelines describe a highly engineered environment When you go in for a Nordlys session, you are placed in a zero-gravity chair.
Okay.
And this chair transmits vibroacoustic sound, so actual physical low-frequency vibrations directly through your body. At the same time, there is stroboscopic light flashing through your closed eyelids, guided breathwork to regulate your heart rate, and specific aromatherapy scents filling the room. You are just flooding the system with sensory input.
The neurology behind that multisensory flood is quite elegant. By layering these specific inputs, they are targeting ancient neural pathways. For instance, engaging the olfactory limbic pathway with specific scents means they are using smell to directly access the emotional and memory centers of the brain.
Without even having to think about it.
Exactly, without requiring conscious thought. Simultaneously, the deep physical vibrations and breathwork stimulate the vagal system, signaling the body that it is safe. It overwhelms the brain's analytical resistance.
You're hacking the hardware to get to the software.
That's a great way to put it. You aren't just verbally instructing a patient to relax. You are physiologically forcing their nervous system to drop into a highly receptive parasympathetic state. Once the hardware is optimized in that state, the hypnotherapy acts as the software update to rewrite those deep-seated anxious or traumatic responses.
The idea that we can use hardware to force a receptive state perfectly bridges us into our next segment. Let's look closely at the actual tools of this sensory hacking, specifically light and sound.
The light therapies are incredible.
The source material for the Lucia N-Degree device is wild. This is a $23,000 light system created in Austria by a neurologist, Dr. Dirk Prolich, and a clinical psychologist, Dr. Engelbert Winkler.
$23,000.
Yeah, it's an investment. It looks like a futuristic halo suspended over the user. The engineering consists of one central, warm halogen bulb surrounded by 8 intensely bright, cool LED bulbs.
And that specific combination isn't random.
Not at all. It's designed to emulate the incredibly wide spectrum of natural sunlight, combining both visible light and thermal warmth. You recline, close your eyes, and the device projects highly specific flickering light patterns right through your eyelids.
What's fascinating here is the brainwave entrainment aspect of this stroboscopic device.
Yeah.
Our brains operate on different electrical frequencies depending on our current cognitive state.
Like when you're stressed out.
Exactly. When you are stressed, anxious, or highly analytical, your brainwaves are often erratic and unsynchronized, typically operating in high beta frequencies. The inventors of the Lucia N-Degree 3 used quantitative EEG scans to demonstrate that their flickering light patterns act as an external pacemaker for the brain.
An external pacemaker. That is so cool.
It literally pulls the brain out of a chaotic state and entrains it into harmonic synchronized activity. Through the closed eyelids, the light hits the retina and the optic nerve, influencing the pineal gland and the visual cortex, driving the brain into dominant alpha, theta, and gamma wave states.
And to ground that in everyday experience for you listening, alpha waves are associated with that relaxed, lucid calm, like right before you fall asleep.
Right.
Theta waves are the realm of deep meditation, vivid daydreams, and creative flow. And gamma waves are linked to peak concentration and sudden bursts of insight. The brochure highlights users experiencing a complete loss of the sense of time, intense geometric visualizations, and a profound sense of peace.
In a fraction of the usual time.
Yeah, they are using this photic driving technology to induce deep meditative states in 20 minutes that traditionally took Buddhist monks years of disciplined daily practice to achieve.
It is essentially a technological shortcut to a complex physiological state. The visual cortex is highly sensitive to rhythmic stimulation, and we see the exact same principle of rhythmic neuromodulation being applied with acoustic stimulation, which brings us to the fascinating biography of Canadian researcher Dr. Lee Bartel.
Dr. Bartel's career trajectory is amazing to me. He actually started out co-developing educational music albums for Fisher-Price.
Really? Fisher-Price?
Yeah. He was analyzing how music aids early childhood development, but by studying the biological impact of sound, he ends up becoming a leading pioneer in clinical vibroacoustic stimulation. He shifted his focus completely from music as entertainment or education to sound as a physical biological intervention.
He fundamentally recognized that sound is not merely an auditory experience processed by the ears. It is a physical force.
The pressure.
Yes, it is a mechanical wave of pressure moving through a medium. Bartel's major breakthrough was utilizing sound as a targeted pulsed stimulation for neuromodulation. Instead of relying on a relaxing melody to soothe the patient, he calculated specific acoustic frequencies to trigger specific cellular and neurological responses.
He went from headphones to full-body sound beds.
Right, sound beds equipped with transducers that push low-frequency vibrations directly into the cellular fluid of the body. In one of his most notable applications, he conducted the first human study using 40 Hz gamma stimulation, specifically targeting Alzheimer's disease.
He was using 40 Hz gamma stimulation, which makes complete sense because 40 Hz is the frequency highly associated with active cognitive processing, memory recall, and focus.
And the clinical data from those studies is striking. Exposing the brain to that specific 40 Hz frequency has been shown in research models to activate microglia.
The immune cells of the brain.
Exactly, the brain's immune cells. Activating them helps them clear amyloid plaques while simultaneously improving cognitive connectivity and blood flow. But his research didn't stop at cognitive decline. He applied the same logic to the body's pain networks.
With the fibromyalgia patients.
Yes. He used specifically calibrated low-frequency sound waves to manage severe systemic chronic pain conditions like fibromyalgia. By driving these low frequencies into the body, the mechanical vibrations essentially interrupt and overwrite the constant agonizing pain signals traveling along the nervous system.
Wow.
Whether we are looking at the flickering LEDs of the Lucille lamp driving visual cortex entrainment, or the 40 Hz mechanical rumble of Bartel's vibroacoustic beds, the underlying principle is identical.
We are utilizing highly calibrated external frequencies to tune the internal frequencies of the human nervous system.
Beautifully said.
Here's where it gets really interesting. Because if we want to talk about the physical infrastructure of the body's internal wiring, we absolutely have to talk about the vagus nerve.
Oh, absolutely. The superhighway.
Looking at this incredibly detailed paper from the MDPI journal, the vagus nerve is the literal superhighway of the parasympathetic nervous system. Vagus means wanderer in Latin, and anatomically this nerve wanders all the way from your brainstem, down through your neck, branching into your chest and wrapping around your abdomen.
Making direct contact with your heart, lungs, and digestive tract.
Yeah, exactly. And researchers have mapped exactly how to manipulate this superhighway using targeted electrical stimulation.
The biological cascade that occurs when you apply an electrical current to the vagus nerve is remarkably complex and systemic. The MDPI paper breaks down several distinct mechanisms, moving far beyond simple relaxation.
Let's talk about the anti-inflammatory part.
Let's look at the anti-inflammatory effect first. Vagus nerve stimulation, or VNS, triggers what researchers call the cholinergic anti-inflammatory pathway, or CAP. When the efferent fibers of the vagus nerve are stimulated, they release a neurotransmitter called acetylcholine.
Okay, acetylcholine.
This acetylcholine binds to specific receptors on your immune cells, specifically the alpha-7 nicotinic receptors. When that binding occurs, it acts as a command module, instructing those immune cells to immediately halt the production of inflammatory cytokines like TNF-alpha.
So to put that simply, VNS functions as a biological electrical off switch for systemic inflammation.
Precisely.
It bypasses the need for anti-inflammatory drugs by commanding the immune system to stand down directly.
Yeah.
That alone is massive for autoimmune conditions. But the paper outlines a whole secondary cascade in the brain. Stimulating the vagus nerve also regulates major neurotransmitter networks.
It boosts the production of serotonin, dopamine, and GABA. It turns the nerve into a remote control for the brain's internal pharmacy.
And the downstream effects of that chemical shift physically alter the architecture of the brain.
The research highlights that VNS activates a critical signaling pathway known as BDNF-TRKB. BDNF stands for brain-derived neurotrophic factor. In neurological terms, BDNF is essentially high-grade fertilizer for your neurons.
Fertilizer for the brain.
Yes. It is the primary driver of neuroplasticity, helping neurons survive, grow, and form new synaptic connections. Furthermore, the electrical stimulation promotes angiogenesis,
which is growing new blood vessels.
Exactly, the biological process of growing new blood vessels, utilizing growth factors like VEGF. So VNS isn't just suppressing symptoms, it is actively providing the raw materials and vascular infrastructure for the brain to rebuild itself.
And this isn't just theoretical lab work confined to animal models. The FDA has already recognized the power of this pathway and approved vagus nerve stimulation for several major conditions. It was first approved way back in 1997 for treatment-resistant epilepsy.
It's been around for a while.
Yeah, and since then, the approvals have expanded to include treatment-resistant depression, obesity, cluster headaches, and most recently, stroke rehabilitation. And the stroke rehab methodology is brilliant.
The paired VNS.
Yes. They utilize what is called paired VNS. They aren't just applying the electrical stimulation while the patient is lying in a hospital bed resting. They stimulate the nerve exactly at the moment the patient is actively performing their physical rehabilitation exercises.
That pairing utilizes the concept of Hebbian learning.
Neurons that fire together wire together.
Exactly. By stimulating the vagus nerve during a specific intentional physical movement, you are flooding the motor cortex with that BDNF fertilizer at the precise millisecond the brain is struggling to relearn how to move an impaired arm or leg. You're chemically reinforcing the new neural pathway as it is being physically built.
The clinical outcome is a drastic acceleration in motor recovery compared to physical therapy alone.
It is truly remarkable.
The research paper points to an explosion of future applications, too. They're currently investigating VNS for inflammatory bowel disease, rheumatoid arthritis, traumatic brain injuries, and tinnitus. But the real game changer highlighted in the research, the evolution of the delivery systems.
Because it used to be highly invasive.
Right. To access the vagus nerve historically required serious invasive surgery.
Traditionally, IVNS, or invasive vagus nerve stimulation, required a surgeon to implant a pacemaker-like pulse generator into the patient's chest and route wires under the skin to wrap directly around the cervical branch of the vagus nerve in the neck.
Yikes.
While highly effective, it inherently carries surgical risks, potential for infection, and significant financial costs. The massive shift we are seeing now is the development of non-invasive transcutaneous devices.
The TAVNS and TCVNS devices. TAVNS targets the ear, specifically a small ridge of cartilage called the cymba conchae. Anatomically, this is the only place on the entire external surface of the human body where an auricular branch of the vagus nerve reaches the skin.
You essentially just clip an electrode to your ear.
Just a clip, and TCVNS uses a handheld device that you simply press against the side of the neck to stimulate the cervical branch through the skin. It takes this profound clinical technology out of the surgical theater and makes it accessible as a handheld consumer device.
This raises an important question. Just because we have consumer access to this incredibly potent neuromodulation technology, does that mean everyone should be using it?
Probably not.
When we enter the realm of biohacking and optimization, it is very easy to view the body as a machine to be constantly upgraded while forgetting that we're dealing with delicate, interdependent biological systems.
It's tempting to look at a device like a Theragun or a PowerDot and just see a fancy massage tool or a quick workout recovery hack.
Yeah.
But the source material from Therabody's clinical manuals, alongside the Better Health Channel guidelines, heavily emphasize strict safety protocols.
You have to be careful.
They explicitly outline that because these therapies forcefully alter your physiological state, whether through pneumatic compression, mechanical vibration, or electrical current, they're absolutely not for everyone.
Yeah.
You have to respect the physical limits of the hardware.
If you force a physiological system to rapidly accelerate or decelerate, you must ensure the underlying vascular and neurological structures can handle that sudden stress. Let's examine the specific contraindications detailed in the Therabody manuals for devices that utilize electrical stimulation, intense percussion, or pneumatic compression, like the recovery air boots.
Like with pacemakers.
Yes. If a user has an implanted medical device, such as a pacemaker or an implanted defibrillator, using external electrical stimulation is strictly forbidden. The external current can cause fatal interference with the rhythm-regulating device.
The manuals are equally strict regarding deep vein thrombosis, or DVT. If someone has an existing blood clot in their leg, applying the massive compressive force of pneumatic boots or the high-frequency percussion of a massage gun isn't just uncomfortable, it is incredibly dangerous.
The mechanical force could easily shear or dislodge the clot.
Right, sending it traveling through the vascular system straight to the lungs or brain. They also explicitly warn against using these devices over bone fractures or if you have uncontrolled hypertension. And with electrical stimulation, the placement rules are rigid.
You never place pads across the chest, over the head, or near the carotid sinus in the neck.
Because you risk accidentally disrupting the heart's natural electrical rhythm.
Exactly. And the high-intensity light therapies come with their own strict dermatological and neurological rules. Devices like the Theraface LED rings or that $23,000 Lucia N-Degrees of 3 lamp emit powerful radiation. The safety guidelines clearly state these should not be used if you are applying common topical skincare treatments like retinol or benzoyl peroxide.
Well, that makes sense. Retinol makes you sensitive to light.
Right. Retinol accelerates cellular turnover, fundamentally thinning the skin's protective outer layer, the stratum corneum. If you remove that optical defense and apply intense LED light, you risk severe thermal damage and hyperpigmentation.
And nobody wants that.
Furthermore, stroboscopic light is universally contraindicated for anyone with a history of epilepsy due to the high risk of triggering a photosensitive seizure. And it should be avoided by those with photoallergic autoimmune conditions like lupus, as the intense light exposure can trigger severe systemic flare-ups.
Even the psychological interventions like hypnotherapy have hard limits outlined. The Better Health Channel fact sheet notes that while clinical hypnosis is generally safe for the average person, it should be completely avoided by individuals suffering from severe depression, clinical psychosis, or schizophrenia.
The altered state can exacerbate delusions.
Yeah. It also strongly warns against using hypnosis to simply mask undiagnosed chronic pain. If you use a trance state to successfully turn off the pain signals in your lower back without ever diagnosing why it hurts, you might be ignoring a ruptured disc or a tumor.
You are turning off the check engine light without fixing the engine.
Exactly. It is also contraindicated for people with active, severe drug or alcohol dependencies. The brain requires a stable neurochemical baseline before it can safely engage in deep subconscious processing.
If we connect this to the bigger picture, all of these modalities, from the ancient practice of altering consciousness to the highly modern application of transcutaneous vagal nerve stimulation, are ultimately just tools.
Very powerful tools.
Incredibly potent tools that manipulate the core functions of the human body. But their effectiveness lies entirely in how intentionally and safely they are applied. You highlighted paired VNS earlier, the genius of pairing the electrical stimulation specifically with physical rehab, or Greg Newton's Nordlys system, pairing clinical hypnotherapy with stroboscopic light and vibroacoustic.
Checking them together.
The true magic and the future of medicine happens in the targeted integration of these therapies, always executed with a profound respect for medical contraindications and the individual's unique biological landscape.
So what does this all mean? Summarizing everything we've synthesized from this massive stack of research today, it means we are officially moving past the outdated, dualistic idea that the mind and the body are separate entities.
They are deeply intertwined.
They are a single, interconnected, bidirectional loop. Whether you are sitting under a halo of warm and cool LED lights, clipping a low-level electrical pulse generator to the cartilage of your ear, or lying on a vibrating bed listening to 40 Hz sound waves, we now have tangible, proven tools to open up the hood and adjust the human nervous system's control panel.
It's a new frontier.
We can utilize targeted electrical currents to lower systemic inflammation without pharmaceuticals. We can use light to induce deep meditative flow states in minutes. And we can accelerate the brain's physical ability to rebuild its own neural pathways.
It represents a profound paradigm shift in how we view human health and optimization. We are moving away from merely suppressing symptoms after they appear. We're learning how to fluently speak the fundamental electrical, chemical, and mechanical language of the nervous system itself.
Which leaves you with something pretty wild to mull over long after this deep dive ends. If our most deeply held anxieties, our perception of physical chronic pain, and even our very state of consciousness could be fundamentally altered by just exposing our retinas to a specific frequency of light, feeling a 40 Hz sound wave vibrate through our cellular fluid, or applying a tiny electrical pulse to a nerve in our ear.
Yes.
Where exactly is the line between our true selves and our biology? If we have the technology to simply tune our brains like a radio dial to feel happy, focused, or pain-free, who is the one turning the dial? Thanks for joining us on this deep dive. We'll see you next time.